4 o'clock. This is November 17, 2016 Board of Health meeting. Malcolm's not going to be here, so I will fill in as chair. Just I'd like to remind everybody that this meeting is being recorded visually and through audio. Does anybody have anything else that they'd like to talk about that's not on the agenda?
That's probably right. You're on the agenda.
Yeah, you're on. Yeah. Hearing nothing, we'll move on to the minutes. Everybody get a chance to look at it?
Mm-hmm. Yeah.
Any corrections?
I think I missed the meeting, right?
I think you were here last
Was I
time.
here for the last one?
Here at last one.
To catch up here. No, because it was the last meeting where you voted on the Hummock Pond homeowners?
Yes.
I was not here for that.
Okay.
So I abstained from voting on them.
Approval, motion to approve the minutes?
Make a motion to approve.
Minutes approved.
Just an observation on that, because I was pleased that you all voted that way on that one. It was an important decision, actually.
Yes.
So.
Okay, first thing, Roberto, Reese Swayze.
Yes, so this is your basic run-of-the-mill ACO. They're waiting for the sewer to come by. They have a compliant septic system, but they want to enter the ACO in this case just to make sure they have the money for when the sewer gets there. Not an issue. We don't have any objections.
Okay. Somebody had to sign that.
Yeah, the whole board would have to sign this one, I believe, actually, Steve, this one's just you, so we do have to
Sign
vote on it.
after.
Mm-hmm. We do have to vote on it.
Oh.
Yeah.
Motion to approve the ACO, 3 Swayze.
I'll make a motion.
Second.
All in favor?
Aye.
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 Okay. So the 36 Friendship Lane, this one's a variance request to do a relief from the setback. The tank is really close to the foundation in this case. One of the things that's been come up is there's 2 on the agenda today, and it was brought up to my attention that both 36 Friendship and 104 Cliff didn't get the notification of abutters due to this type of variance that usually is part of Title V. You get a certified letter to all the abutters to let them know that the meeting is happening here. One of the things that was brought up to my attention also regarding both of these is both of these are retroactive variances. These are variances that were issued by my predecessor, one of them approximately 10 years ago. So it's actually just, they're trying to fix it retroactively. We're trying to clean up the past in this case, is what the variance request would be.
How did it come to your attention? Our attention?
One of them came up to our attention because they were looking to do a addition to the property, and when we went to look through the file, there was no CO in the building office, no signed CO, and there was no as-built plan.
Right. So they were going in to like get a building permit or something, and the checklist picked it up?
Yep, that's exactly what happened. That's exactly what happened. They came up, and the other one is, then this one, 36 Friendships to be specific, is Jeff Blackwell also approached us. Same concept, the addition, but the house had been moved, I believe, to this property, and it was one of those things that they put it way too close to the foundation. Art, do you have any comments on this one, or?
No, I'm not involved.
Yeah.
Okay, just making sure. And then, but we have, as far as the department goes, there's no real objection to it. It's there's a crawl space, not a basement, so it's just kind of.
Do you want to take these one at a time?
Yes, please.
Okay.
Do you want us to go ahead even though there hasn't been a butter notification, or if there's no time problem, do you want to go through that process and bring them back? I mean, I don't know that
I would
feeling
suggest
one way or another.
I would suggest in this case, because one of them is based on a property transfer and the other one is time sensitive for their permit.
So let's go ahead.
I would say we should go ahead, but moving forward, what I'm going to do is I'm going to try to set up some logic models so that we all get a checklist beforehand. So you say, yes, these notifications has happened. Yes, this has also happened.
Any other comments?
I just got one question. So you're saying that you want the septic system, the septic tank to be more than 10 feet away from the cell wall?
No, what happened right now is on this one specifically is when they went to go put in the addition, they found out that the septic system's actually too close to the foundation.
Yeah.
So instead of tearing out the septic system and moving the tank, they're asking for the variance.
So instead of the 10, they'll have 5.5, I think. It's
Okay,
saying.
fine.
Yeah.
All right.
It's just it's to the tank on a
Yeah.
crawl space.
Okay.
It's nothing.
I think the leach areas meet the 20 feet.
The leach
Yeah.
meets. Yeah.
So you want a motion to approve the
Yeah.
variance? So moved.
Second. Okay. All in favor?
Aye.
Aye.
Okay.
8 Upper Topashaw.
Okay, Theta Upper Topashaw. So this is one of those situations where the getting an addition or a new construction that requires a CO triggers the ACO. The IA requirement in the watershed district. So what happened here is there is an addition to be put on the property, meets all the setbacks, meets bedroom count, whole 9 yards, but it has hit that trigger, just like when we did North Pasture. It's got proper separation to groundwater. The only thing here is that it's not an IA, and it's in the Zone A or Zone B. And Ben, would you like to say anything, or?
Yeah.
Yeah, you have to go to the mic.
Mind going up to the...
Ben Shampoo, for the record. So the scope of this project is a sunroom on the south side of our house. The septic system is on the north side of the house. We have a 5-bedroom septic that is fully functional, and in fact, it was just inspected 2 weeks ago and passed without incident. This was when this triggered the IA upgrade. We said, man, this is, number one, expensive, of course. Number two, we just feel like our addition is very benign, what we're doing onto the house. It's not increasing any bedroom count. We live essentially in a 2-bedroom house. We have turned one of the bedrooms into an office. But we have a 5-bedroom septic. We have a CO for a 3-bedroom house, but we have installed a 5-bedroom septic. It was brought to our attention that we could apply for a waiver based on separation to groundwater, which we determined to be in excess of, I forget what it was exactly, Roberto, but well beyond the minimum. So that's why we're here, and that's why I'm hoping that we can go forward on this waiver so we can get this project off the ground.
Well,
What?
the thing is, the one we did, the IA system that was up in North Pasture Lane is a lot farther away than he is. And I just think that if you grant the waiver, then anyone else that puts an addition on or any other problem like that we're going to have to change the direction that we've all agreed we have to go on. I understand what he's saying, and it's kind of foolish, but, it's just a little addition, but the next guy's going to come in and say the same thing. So I don't know how the rest of the people feel, but I just think we're going down, we made a decision to head in one direction, and I think that's the direction we have to continue in.
Yeah, no, I'm afraid I sort of concur, Jim. The North Pasture Lane, there was no addition at all.
No.
So
it was the house sale.
It was just a transfer.
Yeah.
And we set up the regs, though, purposefully, we have to admit, to catch as many conditions that would slowly, over 20 years, bring everybody in the watershed to an IA. And if you back off on one, you're going to have to back off on the next one. So.
Why is the waiver criteria, if you don't mind me asking, why is it even in there?
I was thinking about that today. you're right. I think maybe something like, I don't know how we do that, but I think maybe that little section should be actually taken out.
I mean, if this doesn't apply and your pastor doesn't apply or doesn't, fall within favor of this waiver, what does?
Well, I think that's a good question, and we haven't so far come across an example where we felt a waiver was appropriate.
Right.
And we probably had, I don't know, 6 of these now or something
At
like
least.
that. So I sympathize with your response about the variance, and I think, Steve, I guess you just got to think ahead. Maybe there is some unknown, extraordinary event that might happen. And I don't know what it could be, Ben, but I think it's there for something well beyond the purpose of the regulation as we think about it. I don't know what that would be. And once you take it out, though, then it is automatic. And anyway, so we just have to think that through.
Right.
You know?
Any other? Can I get a motion to deny or approve? Or?
Well, I have to make a motion to deny. I don't want it, but I don't see any other way to do it.
Well, I tend to agree,
Considering
Jim. Yeah.
the way we're doing things. You can't change in midstream.
I mean, you're going to, everybody has not everybody, but there are lots of small additions, and it just, that's the way it is. So I would second the motion.
Okay. All in favor?
Aye.
Aye. Chair votes aye.
Thanks, guys.
Sorry about that.
Oh, Ben, your
Yeah,
thing
Steve.
fell under your chair.
Okay, 104 Cliff.
104 Cliff, same concept, variance for the setbacks. For some reason, I'm missing my Cliff Road one.
This is the same concept as Friendship?
Yes, same concept. Variance, setback. We're looking for maximum feasible compliance here. And what it comes down to is there's no other place to put it, actually.
But this is a new construction, not an existing.
No, it's an existing.
This,
Oh, it is
this one's an
existing,
existing,
same thing, okay.
same thing.
Gotcha. It is what it is. So unless there's something else unusual, I'd be prepared to make a motion to grant the variance the same way we did with Friendship.
Do you have any comments?
Motion to approve.
So,
All in favor?
aye.
Chair votes aye.
These are the kind of meetings.
Yeah.
Some of them.
It's only because it's you, Richard.
Thank you.
Don't forget.
I won't forget.
All right.
We're at 147 Wonwinnet.
Similar concept, except this one's new construction. They're looking to get a variance from the setback to the dunes and to the wetland area. They're within a buffer zone. They are putting in. Let me confirm.
Yeah, this was
Yep.
interesting.
Yeah, this one's a little hard. I brought the large map just so we can have it.
So at the moment, we're talking about an IA system here.
So the
My question is going to be, why isn't it a tight tank?
this one is actually a an IA system. Yeah, it's a Septatech processor.
It's not, I mean, there is a dwelling there, I believe. Right?
There is a dwelling there already. Yeah, if you want to.
Maybe that's why, but is there already an
So this is the
existing
Septatech.
system
There is already an existing system that
that's
they're
a
going.
regular Title V?
Yes, a regular Title V, but their system has failed. So they need to redo it, and as they redo it, they're gonna upgrade it. So, but they're within the buffer zone right now, so they need a variance from us to meet
But
compliance.
seriously,
Mr.
let's just, so,
I didn't realize this one was yours.
Art, so-
I'd be happy to present the application if I could help. Thanks.
Art, I didn't realize this one was yours. I thought it was Don Bracken.
This was a combination of Blackwell and myself for the applicant, Art Gasparo. This is a system that is a proposal that's a true upgrade. That is, there is an existing system on the property that fails for lack of groundwater separation. The new system both increases the vertical separation to groundwater as well as adds IA to the system. There's no increase in the number of bedrooms. Further, the variance that's actually requested
is from a different section of 64 than you typically see. I think you'll note that it's E and F. And the reason is that the area north of the Wawinit Inn is designated as mapped barrier beach. And in that instance, under your regulations and your definitions, that is considered a wetland. So we're actually, it's a system that's within a wetland resource area. The particular wetland is not a vegetated or a swampy wetland, as you may often think of wetlands, but in fact a dune system. And so what we have is you're located within mapped barrier beach and coastal dune areas. The system has been approved by through the Conservation Commission, and an order of conditions has been issued for the system. Again, it is a maximum feasible compliance type system. I think that there are a lot of systems along that stretch of houses that have not typically come before the board. I think that coastal dune and barrier beach areas are sometimes overlooked as wetlands as they relate to the health regulations. A lot of people look and say, okay, we're 100 feet from a vegetated wetland, but in fact, barrier beach, as I saw it, and I stamped the plan for Jeff and said, well, not only do you have to go to the Concom, but you got to bring this to this board as well. And so the relief is not from 64 to not put in IA, but in fact to allow the system within a defined resource area.
Yeah, I think it's a win. It's a win-win for the groundwater.
Certainly.
Right.
If you would like me to address the question about why not a tight tank and considering alternatives, it's because there is an alternative in that tight tanks are typically the method of absolute last resort. And in this case, you have soil conditions that are suitable for the infiltration of the water. You do have surface elevation that rises up fairly significantly in that area, so you are able to provide at least a 5-foot separation distance to groundwater and have suitable soils. So that's the reasoning. And of course, a tight tank then would require either a seasonal use deed restriction or a variance from this board, and then DEP approval. And my sense is that given this alternative, DEP probably wouldn't look favorably on a tight tank request.
In as many words?
Yeah, I mean, look, if that's the answer, but I'm not, we have tight tanks in Crow's Nest, as I'm sure you know, and the soil conditions, I guess, were
very different.
Very different. We have tight tanks across Millie's Bridge, and for a lot of reasons. And this is, where's this drain, to the ocean or to the pond?
That's a long-standing debate. I've done and been involved with several of these properties, and even though another engineer had done quite a study on one to the south, down I think at 137, that was essentially inconclusive, where you put monitoring wells in, and it's a highly variable area in terms of is the groundwater directional movement east or west. I don't know the answer.
Well, I don't know. It just, I'm obviously not the expert here, but it just seems to me that a tight tank, when you're this close to the pond, is an option that ought to be more actively considered. And that's all I'm saying.
The lot's pretty big, and they're actually pretty far away from the harbor.
Yeah, I was going to try to bring up the distance, but I would say it's certainly greater than 200 feet anyway.
Yeah.
So, I mean, it's not, so you've got both a vertical separation, you've got a surface elevation up in that area ranging from 12 to 14, with the edge of the harbor very roughly, say, and being 0. You're 14 feet higher up there and 200 feet away. You're not right at the water's edge, if you would.
So just one more follow-up then. There are, you go up there and there are houses where the road splits. There are two sets of houses, one on the ocean side and one on the pond side. Then it comes together and there's just a single row of houses. And I don't know what, over time,
This is the last one.
Is this the last?
This is,
I assume all
there's,
the others
to,
IAs when they, I mean, I don't know what kind of conditions they have now. Are they all IAs?
There
or
are a
they-
couple.
There are a couple.
I caretake 143, and I think that's an IA system.
it is now, right? We just did that one
Yeah.
2 years ago, I think.
Yes.
Yep. So there's a slow transition, obviously, if anybody wants an addition. They're to an IA. If there's a transfer, it's, falls
So-
under
so
your,
Just making the point, over time, as opposed to over Millie's Bridge, where we're going to over time have all tight tanks. Here, over time, we're going to have all IAs.
correct.
And no tight tanks, in effect.
In effect, right, unless somebody, the other option would be if a particular homeowner wanted to opt for the provision of Title V that allowed for the seasonal deed use restriction, then they could pursue voluntarily, still have to come to this board, but essentially the provision of Title V that now allows for a tight tank subject, in a case of no expansion, no new construction, and if they had a failed system, then they could come in with a tight tank as an option. In this case, again, if somebody, for the most part, doesn't, they don't want to go to seasonal deed restrictions, as you can imagine, are, typically not favored. And so,
Deed restrictions, you mean because?
by owners.
In terms of operating the tight tank?
No, in terms of impacts on property. In other words, most owners, if they're making a decision whether or not to go one route or another. Now, what you might often find is that your initial capital cost for the installation of a tight tank is going to be significantly less than this particular system. So to some owners, given their particular situation, or maybe it is an older school Nantucket type cottage, as there are still some out there, say no problem, we can go that route and save some of the money up front. Of course, your operating cost is going to be greater when you're paying for essentially every drop of used water being trucked to Surfside from there. So there are that kind of a balance. I do think in this situation, given the existing system, which is, the surface elevation above your existing system is 8. So if we just even were to assume that the bottom of that trench is 4 feet lower, it's significantly closer to the groundwater than what we're putting in, and that's without the nutrient reduction. So I think that you certainly have a significant benefit in increase of environmental protection with this proposal.
Did you say that there are no other houses that would be affected by this, or just a minimal number? Is this one of the last ones?
This is, I think, the third to the end. And so, basically all of the houses north of the inn are in the same situation. Though, as you know, as you come to the south where the road does split, you got a little more width there. And some of those houses are, perhaps that groundwater does perhaps go towards the Atlantic instead, whereas this is kind of part of that stretch of houses that are splitting the spine, so to speak.
Some of those houses aren't even in the harbor watershed.
On the east side of
because they
sort of
sort of go
of
to
the
the
split
ocean
of the
state.
split road.
Go on the road, and
Right.
the septics are actually, some of them aren't in the harbor
Right.
watersheds.
Right.
Right, no, I can believe that, yeah. And that would be a different deal. It's probably
Yeah,
not the case
but-
here.
Anything else? Motion to approve or disapprove?
I'll make a motion to approve.
Do we have a second?
Second.
All in favor?
Aye.
Aye.
I guess with reluctance perhaps.
Thank you.
It just sort of seems odd to me, like, it's right there. I hear you about it's a wide, relatively wide there before you get to the pond, but
Yeah.
uh,
35 Tennessee.
Yes, 35 Tennessee. Mr. Giles is actually selling his home. They have paid off the betterment loan, so we just need to approve the release of the betterment. This one needs a signature from every member.
he's one of those that put in an IA system early on, right?
He put in one of the original ones, yes.
Okay. Motion to approve?
So moved.
Okay.
Second.
All in favor?
Aye.
Okay. Just don't forget to sign it before you leave today. And then
Fertilizer.
fertilizer group.
For those of you that don't know me, Mike Miserelli, I'm the chairman of the Fertilizer Advisory Committee. So we've been underway for about 7 months now, since April. So we, at our last meeting, we were talking and thought it'd be wise to come in and just give you a report of where we're at and where we're going. So our very first meetings were to do with regulation overview, enforcement, and the challenges that Jeff Carlson, would have been up against. The people that he was using didn't necessarily know that much about fertilizer. We had timing on our side, that sort of thing. So they were out doing, checks on licenses and that sort of thing. After that, we worked on charter of the advisory committee, but it really comes down to like education going forward is just going to be nonstop with this sort of thing. So education goals was our next thing. Roberto, I believe there's a web page that's in the early development stages that Roberto worked on. But in recent meetings, the most significant thing that we did was individual committee members. Ben Shampoo happens to be one of them. We went to the major manufacturers that produce product that come to the island and chased them down. Lebanon, for example, Harrell's, and worked with them to develop products to sort of give everybody an even playing field and increase the amount of product that's going to be available that's compliant. We got good reception to that, and then also went to all the local island vendors and working with them to have compliant products available. Myself, I buy my stock wholesale and stock it myself, but not everybody has that. So you have a lot of people that are going into Valero's, Island Lumber, etc. There's also some help coming down the pipeline from the state. They're going to have certain requirements of how things are labeled, to the public in a retail. So that's good that we don't have to put all our effort into doing that. We'll get some help there as well. The big thing we're doing right now, though, is we're working on revising the class and the exam. The video, I want to say, is about a 6-hour video right now that everybody comes in and watches. It's a very good video. There's a lot of information in it, but a lot of it is scientific and over most people's heads. So we're trying to dial it down to something that's an hour and a half that works specifically with the BMP. And that's where we're at right now. That's going to probably take us the bulk of the winter to get through and get it developed by springtime. And after that, we'll sort of go for long-term education goals. So that's what I have for you. I don't know if you have any questions, but
Do you have Spanish-speaking instructors
we're exploring the language stuff. Roberto's applied for a grant for, it's not only Spanish, there's Eastern European. We've got about everything under the sun on the island.
So we applied for a grant to the Mass DEP for translation of the videos, of the training videos. So once we do get the training videos done, we'll be able to send them off, and they'll send us back a DVD of all the translation. We can do either dubbing or closed captioning. Closed captioning obviously is cheaper, but we can do it all in any language that we request.
Oh, good. Okay.
So hopefully, we get the grant. Right now it's just a letter of interest. We'll hear back early December whether or not they will invite us to apply.
Is it state or?
It's state. It's funded by the harbor protection license plates. So when you see like the say with the whale on it and things like that, it's all those extra fees go to fund this grant program.
We discussed it on the committee level, and when you go to get your pesticide license for the state, the way the state of Massachusetts does it is if you can't do the test in English, you don't get your license. And then we just didn't feel like we had that luxury here. being what the landscape trade is and what it's made of, there's a lot of, foreign labor. So that's why we felt we needed to go in different languages.
It's been a very productive group. To be, I'm not just blowing smoke here. It's been, we've gotten a lot of things hashed out. It's worked out really well. I'm looking forward to continuing this work that we're doing. This education is probably the biggest step that we'll have on this BMP, on the best management practices that we've had in 3 years. And once we get this education portion stepped down and translated, even if we don't get the DEP grant, there's still other funding sources that we can tap on to get this translated. And I really feel it's one of the better programs that we're going to have, and I think we're going to end up having a model program for the state, to be honest.
Yeah, I think you guys got something. You did an awesome job especially when you hear other towns or other states just are looking at it. So, it's pretty impressive.
Yeah, it's very impressive.
Thank you.
Mike, on the when you were talking about the product and talking to the manufacturers, is there maybe this has already happened, a list of sort of the products that are acceptable, so to speak? So if I went into Valero's, there'd be a list, and you could buy Joe's and Sam's, and they meet the test, and the other ones don't?
Correct. So I'll take for example, Lebanon was my assignment. They gave me 12 products that were compliant, but we immediately knocked 4 of them right off of their list because they had phosphorus in them. But the reason that we wanted to go get the products ourselves is so we could do the calculations and determine if they were in fact compliant at 75% slow release. And then we'll work that list and give it to Jeff Carlson, so at least they, when they're going around looking at stuff, they have a list and they can see what's what. And the products are going to change. Manufacturers change labeling and formulations every single year, so it's going to be a regular exercise for the committee.
Yeah, we are working on a list that we're going to be able to put on the new website once the website gets up and running, which we're working on now, and that way we will have a list of compliant products.
So at the moment,
well,
though, it sounds like for the homeowner who does his own, you'd have to go to the website. It sounds like you're not going to yet get the vendors to say, I promise that's all I'll sell. Are you close to that, or
well,
does that stand?
I think that's a stretch for the committee at the moment to say that's all they would sell, but because there's the interstate commerce issues that we don't have control of, but they would at least have compliant products there, and then the more awareness goes around, the less they'll be selling the other stuff, hopefully.
Yeah,
Right.
maybe just posting the list.
Through attrition, that's stuff that we can't use will sit in the shelves, and sooner or later people will stop stocking it if they're not going to sell it.
Right, but the homeowner has to be able to know that. If I go in and I see there's 6 brands, and I don't find the list there right in front of me,
Right.
I'm just picking something up and leaving. I don't know.
It's our intent to be able to have that list at the vendors themselves.
Well, that's
too.
great to hear.
We've been discussing
I
that.
understand it may not be easy, but it's nice to hear that's a possibility.
There was a significant effort made too to get to the homeowners associations this year, and there was feedback, that I had from my customers asking, are you licensed? Are you using the right products? And that message primarily went out through the land council, but they did get the message out, and when you're getting some feedback for it, it's getting around anyways.
Do you have a list now of the stuff that you want people to use? We
do.
Because I live in Tom Nevers, and I'm on the board at Tom Nevers, so if I could get that list, I could send it out when we send out our monthly letters out. I could send to over 200 people.
Yeah.
Okay.
Sure.
I'll
We'll get
work
you the
on
list.
getting you that list.
Keep it on our radar screen, and when it's time appropriate, get a piece in the paper so that.
Right, we get a PDF, and the associations can send it out by email and so forth. So There are a lot of ways to keep getting
Right.
the message out.
The newspaper did originally cover it, as the season started up, but they were mostly sort of going after the press of who got
Yeah, they
fined
seemed
or
like
Got
that
hit,
one
yes.
article, didn't they?
right.
Yeah, they were more interested in I think the word they used is slapping people with fines. They were a little bit more interested in that than the actual prevention strategies that we were working on. But I think moving forward, I think now actually hitting the year-round people who know about the whole concept of the brown lawn, the green lawn, whole 9 yards, that it's actually not just what you see. It's more. And there's a lot of misconceptions that everything is caused by the landscapers, and it's not. And it's not. So we've done some pretty good strides in getting this information out. We've been seeing a lot of the information coming out on the end of the end user, where we've had people call at the office saying, I've seen this, I've seen that, please call me, things like that. We've spoken with other, our committee here, we've had other landscaping companies speak with our committee members saying, I don't want to get hit, how do I get compliant? So the word is definitely out that we're looking at it, and the best part behind it all is in such a quick turnaround. We've, like you said, 7 months, we've already seen a lot of this turnaround. And we're seeing this compliance work. People want to comply. The word is out, and it's really kind of great.
Great.
Great,
Okay.
thanks.
Thank you.
Thank you, Mike. I really appreciate it. All right, Ben, I'll see you tomorrow.
Okay, venison.
All right. Good news about the venison program. Last meeting, we weren't sure if we were going to be able to pull this system off this year, and Hank just came out at the bottom of the ninth and found us a kitchen and a processor. So Dylan Wallace will be processing the venison. I'm going to be getting that information out as soon as I can. And Patrick Ridge, who just recently bought the Gray Lady, is going to be allowing us to use the Gray Lady's kitchen since it's going to be closed before he starts renovations at the end of the year. So he said, feel free, use this facility, and it's actually large, it's really big. And then Annie from Annie's Whole Foods is letting us use her grinder. She's donating her grinder to the program as a whole. She says she doesn't want it back.
Dylan Wallace is the processor.
And-
He's the one who'll be doing the butchering.
Yes, and Dylan Wallace himself will be doing the butchering. He has a lot of experience when he used to butcher sheep as well, and he knows the whole process. He's ServSafe certified, allergen certified. He knows the cleaning process. So we are really excited that this is actually coming off the ground again this year. We have spoken with the donor. The donor is still on board. So as soon as I can get the flyers redone tomorrow morning, we'll be able to get this information out. Hopefully we can get it into the newspaper next week too.
Can we put that in the Inky Mirror?
We're going to try to get that into the Yankee next week.
Okay, good.
We're really excited. At the last minute, 11th hour, it came through.
That's good.
Good for Hank.
Yeah.
Hank's still here. Is he gone?
Hank still, it was his last day. His last day, he was able to track down a kitchen. One of the suggestions from Patrick was that with next year, with him having the Gray Lady will be open, we might not be able to use that. Hopefully the Marxes will be okay with opening it again next year. The reason they had to back out this year was health issues. Hopefully it'll be taken care of by next year. But if not, Patrick suggested that we do own the Jetty's kitchen. It is a town kitchen. And it is closed at that time. And it does have parking lot, and it does have loading ramps. So it is something that we might want to look into. We can speak with the new leaseholder, see if we can use that kitchen next year. But Dylan is really excited to do the work, and he's really excited to continue doing it next year if we need him. So we're really excited.
That's great.
And then
Okay,
that's his report. So I've become part of the I'm a voting member now of the Behavioral Health Task Force. I was added to that last week. So as part of that group, one of the things that we'll be tasked with is looking at epidemiological studies on opioids, substance abuse, alcohol abuse, things like that. We have a lot of data already on this issue, but nobody was able to do the analysis on that data. We didn't have an epidemiologist. Well, the town now has an epidemiologist on the Board of Behavioral Health Task Force and a statistician. So one of the things that I'm going to be doing over the next 2 months is collating some of this data, doing some full analysis, hopefully some causality data, and we'll be able to break down the rates between age groups, income, other types of social stratification, so that we can start using that information down at for grant applications. We can hopefully apply next year. If things go well, I'll be able to have this project done by the end of January, and we'll be applying this coming grant cycle for the large SAMHSA grants, which is the Substance Abuse and Mental Health Services Administration, as part of the FDA. So we're really excited to move the health department and the whole coalition, is really large. All the churches, the Nantucket, I think it's the Community Foundation with Margaret Andrews, the Fairwinds, which was Family and Children's Services, the police, fire. We have ASAP, we have ASAP, which is the Alliance for Substance Abuse Prevention. We have Autism Speaks. It's a very large group. And it's co-chaired by Kevin Marshall of the police department and Walter Wieners, who is an outside consultant, but who has extensive experience with the Affordable Care Act. He was one of the writers for the Affordable Care Act, so he'll be helping us with that. It's great to have him on board as well. And so we're looking forward on that part. The other section is trying to get Nantucket as part of the national spotlight on us, because we're doing some really cutting edge work. So as part of the National Environmental Health Association, I joined and was recently voted in as the chair of the National Food Safety Committee. So as part of that, as the chair of that committee, one of the things we're going to be doing is writing national policy for food safety. And if things go well, we'll be able to start getting a lot of these publications out, and we're going to be doing policy papers and what are called white papers, basically for the practitioner, published out so that we can use the examples that we have here. Nantucket is by far ahead of the curve on some of the food safety work that we've been doing, our water quality work here. The fertilizer work that we've been doing has been unprecedented. There's only a few areas in the United States that do it, and most of them are around larger towns. Our water quality work, especially the fertilizer, we haven't seen anything like it unless you've been in either the Chesapeake Bay area, Cape Fear, or in the Puget Sound. Those are the only three that I've found that has a fertilizer best management practice. So we're doing something great here. It's time to be recognized for it. And then lastly, I've been actually partnering with Jason Bridges, who you've been seeing taking pictures today. We're to start on the new website. We are going to be taking some pictures. We're going to be revamping the website. It's going to have its own website address, so it's not only going to be part of the Nantucket-MA, but we can have something like ackhealthdepartment.gov or something along those lines, kind of like the Memorial Airport, so that we can spotlight some of the work and make information easier to find. The biggest complaint that we've received as far as the sewer system goes is that the information was too hidden in the website. So we're going to try to fix a lot of that. So we're bringing in a nice face to the department finally. And the staff has been working really well. We're heading into some vacation season right now and some holiday season. So we'll be every week from now to the end of January, there's somebody out at least once a week. But it's luckily our slow season. We are in permit renewal season, and we should have all the permits, except for the seasonal permits, renewed by December 31st. So we're in good shape.
So which permits you talking about, for example?
All the food permits, for example, every food permit, all the lodging house permits, and tobacco permits, things like that. Though all the seasonal retailer licensing, the operation licenses, they'll all be renewed by the 31st.
Do we have any direction on where we're gonna go next season with food trucks?
Food trucks are the food trucks are a little hard. We do have direction from the Board of Selectmen on that. They did vote in the food truck. What's that word? The guidance document from when was that? That was 3 months ago now. Something like 3 months ago was voted in. So we do have guidance as far as the food truck goes. That is part of a retail establishment for catering purposes go. Those can't really be regulated other than by just a simple health regulation. So, for example, Island Kitchen, they're a perfect example. They have a food truck that they use only for catering. It gets fully licensed, whole 9 yards. They just don't take it to Surfside. They don't take it to Dionys, anything like that.
Would that be the same for the Seagrills truck, for example?
Yep. So if they're going to do any of the street vending, they need to go through the process that was set forth by the Board of Selectmen. However...
So the board authorizes them to be in the business, but you inspect them for public safety.
Correct. So we don't foresee an issue with the food trucks this coming season. But then again, you never really foresee that far ahead.
Okay.
Just one follow-up on the earlier discussion about the statistical analysis you're going to do.
Yes, sir.
What's the source of the data, of the underlying data? Where does it come from?
Yes, the raw data that we get is from both the youth risk behavior and the Pride survey from the high school and the middle school. We get some data from the hospital on psychological crisis evaluations, psychological review. Fairwinds has also a lot of raw data on the patients that they do have. It's all de-identified for HIPAA compliance. Mm-hmm. So they have a lot of raw data.
So you might get data that has, 10 elements per patient or something? I'm trying to think what items. It would be interesting, I think, if you just sort of shared with us
Absolutely.
items that you can statistically analyze, because it's not just like one item.
Absolutely. Tomorrow I'm actually meeting with the Behavioral Health Task Force to hash out what we're going to focus on. But it can be anything from incidents of crisis intervention, uses of Narcan, how many, I forgot the name, the evaluations have been done, suicide prevention evaluations, ideation of suicide, use of...
A patient.
These are all questionnaires.
So that a person might have had 5 interventions, or whatever the data brings to you.
Exactly. And we can de-identify it and break it down by incidents, so it's the amount of times anyone they've had an intervention with, or we can break it down, which I don't know if we're going to stratify it this deep, where it says, on average, each patient that has had a crisis intervention has had 2 interventions in the past 5 years. But we're trying to get that information. We're going to be using that information.
Part of the idea would be to say that when you get to the most serious events, for example, were there trigger points 2 years before? You got to find some usefulness out of it too.
That's exactly what we're going to try to find out. So if we can drill down, if the data is I wouldn't say easy enough, but cleanable enough, if we can clean the data to a point where we can break it down to a per patient ability, we can break it down to that point.
And then you have to make sure you have enough of patients or events or whatever to make it statistically
Significant.
valid, is
Mhm.
significant or something.
Yep.
You can't just have 5 of them.
Exactly. The term is statistically significant. We don't foresee issues with statistical significance, mainly because of the basic crisis intervention numbers from these past few years. I think it's the last 2 years was 23,000 events, connection points in the past 3 years, I believe it is 3 or 4 years, and that's everything from just a regular patient interaction to a full crisis.
And it could be one patient for 100 times, or one
Exactly.
patient for one, whatever it is.
Exactly.
It's interesting.
If a patient comes in once a week, well, that's 52 instances. If a patient comes in twice a week, that's now 104
So
instances.
if a patient is in counseling and
Mhm.
has a once-a-week counseling session for a year,
Hmm.
that would be 52 events.
That's 52 events. Exactly. Exactly.
I just think it would be interesting because it is a serious issue, and
Hmm.
it would help us understand sort of what we're doing here to
Mhm.
share that information.
The Surgeon General this morning actually released an edict saying that it's time that we put a spotlight on opioids. It is the single largest growing health concern in the nation right now. So I think there's going to be, if we can get ahead of this grant cycle, because it's already been said, this is the most important issue, and our president-elect has even said this is an issue that he wants to look at. So it might be something that we want to get ahead of.
Just to when you use the term opiates, is that meaning different from cocaine, let's say? I mean, so it's the prescription type things
Yeah,
that you're focusing on?
Yep, opiates are any drug taken as an extract from the opium plant. So that is everything from morphine, oxycodone, Percocets, Darvocets, Vicodin, all the way through to heroin. So anything that is derived from an opium plant.
So that would include someone who is getting heroin illegally?
That would include the illegal heroin addiction. Yep. And Narcan use is our incidence rate to see how many overdoses we've had. You don't give Narcan unless they're in the throes of an overdose.
That's usually done by a professional, the police department usually.
Yep.
Whoever.
Yep.
Those are reported.
Those are reported, and they are automatically logged in as a crisis because it is required to be an intervention.
Giving Narcan to families, though, too, now, or you're talking about it?
There is one. That is one thing. Narcan is legal and doesn't require a prescription anymore. So those numbers we won't be able to get a hold of because there is incidents of family members giving Narcan to other family members and not reporting it.
That's what you were referring to, Helene? I didn't.
Yeah. So the medical term, you'll also hear the term Suboxone used. So they.
It's Dr. Leprey's clinic.
Mhm.
Yeah.
Yeah. So you'll hear those two terms
So
thrown
how
around.
how would a private party get them? They call somebody up and ship it over?
You can.
One of their family members is an abuser, so they're preventing death, basically.
So, but where would you get it?
You can get it at any pharmacy.
Well, why can't we can't track the pharmacies? We don't have to know where it goes. Why can't we track the pharmacies? How many?
We can't track the pharmacies, and it's the information that we would get is prospective, though. It's from now moving forward. As far as the data analysis goes, for the grant purposes, I'll be looking retrospectively, but we can definitely start collecting that
to
number.
see where we're going from today forward.
Actually, I mean,
Yep.
it's interesting.
Yep.
I never knew. So a private party can go into the pharmacy and say, "Can you give me one of those?"
Hmm.
No prescription. Nothing.
I
Just
don't have
no
to have
prescription.
someone in my family. who's
so you take it right off the
using
shelf.
At risk.
It's not on the shelf. You have to actually ask the pharmacist for it, but you don't need a prescription for it anymore.
If you have to
I
sign
don't-
for Sudafed.
I don't know if you have to sign for Narcan. Actually, I don't think you have to sign for it.
So,
Yeah.
so is there anything you could do to talk to the drugstores? On
Absolutely, we
I
can.
mean, I think we should know that. I think we should be able to keep track of that, even though it's not going to help you in the stuff
Mhm.
you're doing. But from today on,
Yeah, moving
Good
forward,
point.
it's a very good point. I think we
I mean,
can, and
mandating
we're in the right time.
pharmacies for specific antibiotics to track the Lyme incidence
Mhm.
of Lyme disease about 3 years ago.
yeah, you're right.
Yeah.
4 years ago.
And
So
also,
within our jurisdiction, yeah.
And along those lines, the good news is on the tick, as far as the tick-borne diseases go, we Stephen Tidd, the newest, he's, well, I wouldn't say new anymore. But he's been around as long as I have. He's been really strong at going to all the doctors, all the general practitioners, and getting exact numbers of tick-borne illnesses. So he was saying that the drop that we saw this year was actually to be expected, because what he was doing is actually teasing out the information. Is this a tick-borne disease, or is it just a suspected tick-borne disease? So he's been actually cleaning that data so that we can have actual hard data. So that's why we saw that big dip this year.
Would,
Yeah.
would doctors be prescribing this to out of their offices?
They can, yes.
So could we keep, would they?
Yes, we can definitely get the information from there too. I'll talk to Jason Graziati.
I think that's very important if we could start, you know,
It's
tracking how much of that stuff is getting used.
it's a major part of what public health is, tracking this sort of data and analyzing it and working for prevention. We've been relying a lot on the hospital to do it, but the hospital is stretched so thin that it's actually not really in their radar right now. They're more worried about the quality of care than quantity of care. So that's part of the burden that we should have been doing for the past few years. But by no fault of Richard, by no fault of the department's own, it's just simply the capability wasn't there yet.
But I mean, if we have numbers that we can say, listen, we know how much this stuff is.
And that's what I'm trying to get. I'm trying to get that together.
What's that information they just released on the news this morning? It's
Oh, I
the
have-
first time in years. Some of the substance abuse and
Oh, I haven't seen that.
Americans. You didn't see that? It's
No,
like-
I haven't seen that yet.
It was just 21 million people.
Jeez. Out of what, 360?
It's the
or
first time
whatever?
they released information like that in years. It was on the news this morning.
I'll have to look that up.
Yeah.
It may have been coupled with the Surgeon General's report.
Might have
That,
been.
that might have actually been part of it. I read his statement. I didn't read the report yet. That might be what was on
They
the
broke
news.
it down from, like how many deaths last year were caused by this and that.
Mhm.
It was pretty high.
Wow. There is a national database that I can tap into so I can do the comparison. And I know there's a state database as well. So one of the things that I can do in the analysis that I'm planning on doing and the reports that I'm planning on doing is to compare. This is the standardized incidence ratio for the state, for the nation, and for Nantucket. So it's part of what we're going to try to do. I'm going to try to use this as a community health assessment, apart from the one that the hospital is already doing, so that we can apply it to our accreditation efforts, so that we can get the health department accredited.
That's great.
Great.
Anything else?
That's good.
I guess we
Well, just let me ask you a question. Any update on the sewer, how the funding and is anything happening? The bids going out or bids coming in, or
Well,
do we select anybody? Or
Yeah, we had, I guess maybe it was 2 weeks ago, the project manager came in and gave a report to the board on sort of the design process. We had to let another contract, for example, to allow for borings to take place. So they're actually doing some work now
Yep.
and moving forward. So that's the story there.
And don't forget to sign the 2 documents.
Oh, yeah.
Don't forget
Okay.
to send them out. Motion to adjourn? Okay, so moved.
okay.
Thank you, Art.
Do we